She Who Awakens by Alina Chamberlain. Neoplastic dynamics and visceral stagnation. Managing fibroids, polyps, and ovarian cysts through metabolic and vascular regulation. A woman's journey toward radiant health and full orgasmic expression requires an internal environment free from chronic inflammation and benign cellular overgrowths. Among the most common gynecological challenges women face today are uterine fibroids, leiomyomas, endometrial polyps, and ovarian cysts. When diagnosed with these conditions, women are frequently met with a clinical approach of watchful waiting, where physicians monitor the patient through biannual ultrasound examinations to see if a fibroid expands, if a polyp alters the uterine lining, or if an ovarian cyst ruptures or grows in response to the menstrual cycle. While clinical surveillance is absolutely vital, a sedentary lifestyle often leaves these tissues in a state of chronic hypoxia and fluid stagnation, which acts as a major catalyst for the progression of these conditions. Intimate gymnastics serves as a profound structural and metabolic intervention designed to alter the local environment of the lesser pelvis, optimize hormonal communication, and support the body's natural defense mechanisms to prevent these overgrowths from expanding or causing acute pain. The pathophysiology of pelvic stagnation and neoplasia. To understand how benign overgrowths like fibroids, polyps, and cysts develop, one must examine the delicate relationship between local blood flow, lymphatic drainage, and hormone receptors within the pelvic cavity. The uterus and ovaries are highly vascularized organs composed largely of smooth muscle and endocrine tissues that are incredibly sensitive to hormonal fluctuations. When a woman experiences chronic pelvic congestion, often caused by a lack of deep muscular movement, shallow breathing, or poor core mechanics, blood pools within the venous networks of the lesser pelvis, and lymphatic fluid slows down. This pooling creates a localized hypoxic, oxygen-depleted state. Tissues that are starved of fresh oxygen and trapped in stagnant metabolic waste trigger low-grade inflammatory signaling. This environment alters local cellular behavior and causes an abnormal upregulation of hormone receptors. Furthermore, stagnant fluid prevents excess hormones from being efficiently cleared from the pelvic cavity. This results in localized estrogen dominance or unmitigated hormonal stimulation, which serves as the primary fuel for the proliferation of uterine fibroids, the sprouting of endometrial polyps, and the development of dysfunctional ovarian cysts. The 5 columns of somatic reconstruction. Intimate gymnastics directly reverses this pathogenic environment by re-establishing the 5 foundational columns required for visceral health and cellular balance. 1. Neuroendocrine normalization. Because you cannot move the smooth muscles of the uterus or ovaries through direct thought, intimate gymnastics utilizes the rhythmic, targeted contraction of the surrounding striated skeletal muscles to stimulate local nerve pathways and vascular beds. This deep pelvic movement improves signaling along the hypothalamic pituitary ovarian axis. It optimizes blood flow directly to the ovaries, providing them with the necessary nutrients to manufacture hormones efficiently and helping to resolve the imbalances, such as unopposed estrogen or low progesterone, that drive cystic and neoplastic growth. 2. Complete vascular and lymphatic clearance. By acting as a localized muscular pump, intimate gymnastics accelerates venous return and opens up sluggish lymphatic pathways. This mechanical action flushes out trapped cellular waste, reduces interstitial swelling, and sweeps stagnant hormones away from the reproductive organs to be metabolized and excreted by the body. 3. Deep tissue oxygenation. Pairing pelvic floor exercises with precise diaphragmatic breathing deeply saturates the arterial blood supply with oxygen. When this highly oxygenated blood is driven directly into the uterine and ovarian tissues, it reverses local hypoxia, neutralizes anaerobic inflammatory environments, and encourages normal, healthy cell replacement. 4. Nurturing the biological vanguard, the microbiome. A beautifully vascularized, well-oxygenated vaginal and uterine environment creates the ideal conditions for a thriving, protective microbiome. This local army of beneficial microorganisms does far more than simply ward off infections. A healthy local microbiome actively synthesizes and metabolizes critical vitamins and trace elements right at the tissue surface, including B-complex vitamins, magnesium, and vitamin E. These bioavailable nutrients are absorbed directly by the local smooth muscle cells, providing them with the necessary cellular resources to maintain structural integrity and resist abnormal growth. 5. Reinforcing local immunity. By optimizing tissue cleansing and nutrition, local immune cells, such as macrophages, natural killer cells, can navigate the pelvic tissues unhindered. This robust local immune presence ensures that cellular mutations are identified and managed early, building an internal defense system that naturally helps prevent the progression or recurrence of polyps and cysts. Clinical tracking and safety guidelines during training. While intimate gymnastics is an exceptionally powerful tool for stabilizing and reversing pelvic overgrowths, it must always be practiced with strict medical awareness and clinical accountability. Benign tumors and cysts require regular medical surveillance, and you must maintain your scheduled gynecological appointments and ultrasound scans at least twice a year to track the exact dimensions and dynamics of your condition. Critical gynecological protocols. 1. Biannual ultrasounds. Monitor the exact size, location, and fluid dynamics of fibroids, polyps, or cysts. 2. The flare-up pause. Immediately halt all pelvic training if you experience acute pain, bleeding, or rupture. 3. Resume with caution. After clinical resolution, return to base training for 1 week before using tools. 4. Exclude internal tools. Keep weighted vaginal balls or eggs out of your routine during active acute flare-ups. If you experience an acute flare-up, such as severe menstrual cramping, sudden pelvic pain from a rupturing or expanding ovarian cyst, or abnormal uterine bleeding, you must immediately halt all intimate gymnastics training. Increasing blood flow to the pelvis during an acute inflamed or bleeding episode can exacerbate your symptoms. Focus entirely on resolving the acute flare-up alongside your physician. Once your gynecologist examines you and confirms that the inflammation has cleared and the tissues are stable, you may safely return to your intimate gymnastics routine. However, you must practice without any internal training tools, such as weighted vaginal balls or eggs, for at least 1 full week following a flare-up. This allows your tissues to readapt to basic contraction and expansion safely, ensuring your path to recovery is stable, comfortable, and profoundly effective. Discover the secrets to nurturing your lifestyle and love style at Wish for Love. The electronic version of all chapters from the full book She Who Awakens by Alina Chamberlain can be found at wishforlove.org.